A very popular treatment these days is something called radiofrequency microneedling or RF microneedling or microneedling with RF. These are all terms that are being used for this particular type of technology. So the question is, what is it? Why is it special? How is it different from regular microneedling? When you do regular microneedling, which is a much older technology, it's actually not an energy-based device, so it actually doesn't generate any heat. Your microneedling that's done professionally in the clinic is actually a pen with a motor on it that allows needles to go in and out very quickly, oftentimes at 6 times per second into the skin. You're generating these little channels in the skin to allow for new collagen to form. So it's a low-level stimulation of the collagen, and that can help with things like pigmentation, skin texture in general, but usually the results are limited. The reason radiofrequency microneedling has come out is because it actually treats a different part of the skin. What happens is when you do an RF microneedling treatment, the needles are actually there to help deliver the energy. That is their sole purpose. And so it's not actually the needles that are causing the collagen to form. Regular microneedling with 6 times per second, you're actually generating those little tiny pockets of stimulation. With RF, it's just more of a stamp. So it goes into the skin, energy is released, radio frequency energy, heats the skin surrounding each needle tip, and then the needles retract and go to the next area. That special ability for the needles to release energy is why radiofrequency microneedling is very effective. You have a grid-like appearance, but each needle, based on the ability to release heat in a controlled manner, will allow something called coagulation. Coagulation is the ability to change the structure of the collagen around the needle tip without causing it to ablate or just be gone. The coagulation actually is what gives you the maximum amount of volumization. So each of those coagulation zones will generate an even larger zone of collagen when healing. This is why RF microneedling, when done well, generates a volumizing effect that affects deeper in the skin and can better treat things like deep scars, atrophic scars, larger textural irregularities, contouring, and skin firming and thickening, while regular microneedling tends to be more of a surface change where you get a nice glow to the skin or improvement in some of the texture and tone that you come to expect from regular microneedling. So those are the major differences. With radiofrequency microneedling, a couple things matter. One is the device itself. There are different generations of RF microneedling. Some are what we call monopolar, where the energy passes through the patient's body. The other one is called bipolar, where they pass needle to needle and the energy is transferred that particular way. The newer generations tend to be more of the bipolar. So when the needle goes in, the needles all communicate with each other and you get this area of heat. The second option is that a lot of these RF microneedling tips have what we call insulated needle tips, where the top part of the needle doesn't release any energy. So it's really only at the deeper part of the needle where that energy is released and where you get that nice volumization deeper in the skin. If the top layer is affected by the heat, sometimes it will cause hyperpigmentation. And so we really don't want that. It's not a desirable effect. And it's something where you can't do on darker skin types if there is an RF microneedling device that does not have the insulated tips. So insulated tips are very safe for all skin types, while non-insulated tips are not safe for darker skin types. Those are kind of the differences. So make sure that before you do RF microneedling that you actually know which brand you are gonna get it from, and also the training of the people that you get it from as well. So make sure an experienced provider is doing it, that it has, it's the right device that you want to treat your skin, because they all have their own set of pros and cons. And so do your research beforehand, or you can actually talk to a specialist to see if there is a difference, and then can go from there. Hope this was helpful for those of you considering RF microneedling to treat various skin conditions, and follow me if you have any more questions.